holistic route. And I will explain to you what is holistic route and what it is. You know, that I suddenly realized that treating the teeth and doing the fill and drilling and fill, it's not the thing I want to do. I want to heal the person. I want to heal the person who sits in front of me. Because you know, this is not like fill and drill, it's mechanical. I want to be a doctor, I want to be a healer, and this has changed my life. I just interested about person who sits in front of me and how my job can make them healthy. This is only my focus. How to make you guys healthy. And that's what we're going to talk about the toxicity in our world. And this is our event going to be just about the dental toxicity because I know a lot about it. I want to share it with you just a little bit pieces of iceberg, a little bit information because it's a lot. I can talk hours if you're really interested. All right? If you look at this dental material that exists here, you have no idea how many there is. Most of the dentists have no idea this is 6,500 plus dental material exists to deal with anybody's problems. And this is a huge number, highly significant. And this is a huge number. And the number is just represented what we're dealing with. And some of these material is very toxic and very just abrasive and they have a lot of problems. And we talk about mercury films. Whatever film they call you silver, it's not silver. It's mostly mercury. We have a lot of problems that we are using in dentistry. 50% of dentists still in the United States using silver films. Everybody knows that mercury is bad. You know that most dental offices using fluoride. And a lot of holistic doctors and researchers talking about that mercury, fluoride, root canals. It's not the ideal alternative for your health. It's not. And this is a lot of talking about, and a lot of patients come into my practice who have the health issues, and they cannot answer the questions. They have a question, they have no answers. And you know, doctor look at them, no, it's you're wrong, you know, you don't do right, you know, that everything is fine with you. And they can't find the answer, they come to me. Because I look at the person. I don't look at the tooth. I don't look at only one thing, I look at a lot of things. And this is what we're going to talk about. If you look at silver fillings, and silver fillings in reality, it's 50% mercury. And everything is silver, copper, tin, a lot of different metals. It's combined. And it's quite dangerous. Because you know that OSHA, it's an organization to protect the employee at the workplace. It's just required to have a special spill kit for the dentists who use silver fillings. Because a piece of this just fall on the floor, and if this capsule just get broken, this capsule gonna get broken, it's a big deal. And they have to call the people in the hazmat materials, and they have to clean it up. And this is dangerous. You know that friend is hygienist. Many years ago, she used to polish silver fillings in your mouth. Patient coming in and make the silver fillings shiny. But they figure out that hygienists inhale this mercury vapor every minute that they do it. And they tell them, not anymore, and they stop it. And this is a lot of things going on. And you know that it's more happening later on. We found out that the mercury from the dental filling that we're drilling in, getting into the drainage system, and getting our water supply. Now we're talking about you can't eat fish, pregnant women not allowed to eat fish, and this is something really concerning all of us. Excuse me. And this is amalgam separator. In 2009, it's become the law in the state of New Jersey. Every dental office is supposed to have this machine. I put this machine in my office in 2000, as soon as it became available, way before it became a law, because I know. I really care what's going to happen to this planet Earth for my kids and maybe future grandkids. You know, I'm a person like you are. Every time dentist touches your silver fillings, it's expressed a lot of mercury vapors. It doesn't matter how. It's a drill, a polish, or anything else. It's expressing mercury vapor. And going into the lung, into your bloodstream, into brain. Stay there, make it damage. And very often it's less dangerous. Leave the filling alone than touch it. I'm dealing with a lot of complications if I don't remove properly. Pieces left underneath, pieces get underneath of the gum, Patients have a very bad reaction to the health issues, and that's why we propose to our patient very extensive protection. It's the same dentistry. If you look at protection, all these gadgets, all this technology around, it's really protected. Patient breathing with oxygen, we have a special mask, and we're using protection for ourselves too, because we know how bad it is. And if somebody ignorant and does not know about it, this is their own business. But I want you to be educated. I want you to have a knowledge. I want you to have an understanding. If you need silver filling to be touched, you really have to ask the dentist, is he going to protect you or not? Because legally, there's a dentist not supposed to protect you. It's not. Okay? Legally, we're supposed to do the job, but about the protection, it's different. International Academy of Oral Medicine and Toxicology developed a whole protocol, how to protect the patient, what supplement to use, and everything else. And I'm a accredited member of this organization. And my staff, entire staff, all doctors that work in our office, dental assistant, hygienists, know about how to protect patient from the mercury vapor. We're very good at this, by the way. You know, and you have to ask your dentist, is the dentist mercury free or mercury safe? Mercury free, who doesn't place those, but mercury safe, somebody who knows how to do this. Because it's a very, very important protection, protection, and protection. Because you have only one health.
Can you say that again? What is the difference?
You know that mercury free, it's a dentist who doesn't place silver fillings. Mercury safe, who knows how to deal with those silver fillings that do not affect you. It's very important to protect you, because then you're removing it, you're exposed to the mercury. And the oxygen, the special suction, and everything else, it's a special device that just improves protection. It's very, very important. You know, that is, now I'm going to show you something interesting. You know that a lot of people have no idea, and 95% of the dentist never seen it in his life. There's a special test. If any of us need extensive work, for example, some of you need extensive work, I have any chronic disease, a lot of allergy, I request patient to go have this test done. This is biocompatibility test. It shows you what material is good for you, what is not. There is no maybe. This is material good for you, or it's not good for you. And we're going extensively with all these pages. This is, whatever I said, 6,500 dental material here, these pages. This is a big, thick book. And I, or my main assistant, or associate doctor, going through this, and we really write it down, what we can use for you, and what we cannot. And it makes a big difference. Because it does not matter what's going on in this life. You might not know about it, but I do. This is my responsibility, and this is not legal one, this is inside of me, to protect you, because I know. Patient knows about how dangerous it is, or does not know. It doesn't matter for me. I know, and I take responsibility. You know that another controversial thing in our life is root canals. You know that there's a dentist, there's a bit push in our head. We have to save every tooth, we have to save every tooth, and this is what we are doing. We're doing root canals. In many instances, it's not good. Because root canal, we see only few straight roots, and that's it. We don't see all these small branches. And bacteria, they sit in those small branches. If your immune system is great, and you know you're healthy, no problem, because body can deal with anything. But if its immune system is weak, and body is not strong, any underlying condition, any underlying diseases, bacteria will start acting up. And sit in all these small channels and just create the toxins and affect your body. And this is very serious. You know, because everything in our body connected, and everything is our body affected. You know, this is a chart show that every tooth in our body connected to certain organs. Today I had a patient, and I just look at the tooth here, how is your thyroid? She looked at me like, how do you know? No, I don't know, I'm just asking you a question. So, did you read my medical history? I tell you, no, I didn't read your medical history, because whatever you wrote down for me, you didn't write it down that you have thyroid problem. Do you have thyroid problems? You know, yeah, my thyroid is shot. And take medication for this. How do you know? Because these particular teeth affect your thyroid. So look at me. Wow. And this is interesting thing that you know, because holistic mind is set different way. I really not worry about saving one tooth. I'm worried about just making your life healthy. Because if this is little guy to interfere with your life, need to go. This is for the dentist, big statement. Because we're trying to save everything, but if it interferes with your health, the entire immune system need to go. Because your health is much more value for me than one tooth. You know, this is an absolute different point of view. And every tooth in your mouth is just connected to different organs. I can tell what tooth affect the digestive system, what tooth affect thyroid, what tooth affect the heart. It's not a secret. This was developed 5,000 years ago. There was developed acupuncture. Chinese developed acupuncture 5,000 years ago. And they knew each tooth connected to certain organs. And sometimes this organ become bad and tooth after that become bad. And sometimes the tooth become bad first and after the organ become bad. But as a holistic doctor, I know what I'm talking about. Somebody who want to save the root canal, and you know that I want to save the root canal. And you know that I know this gentleman or the lady who sits in my chair, she's going to get up from my chair, going to go to somebody else. And she's going to do a root canal regardless. Because she just attached to her tooth. And I have to give them any chance to make it better. And that's why we're using in the office ozone. Ozone, it's a gas. It's a natural gas. It's the top of the atmosphere. Protect us.